Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers, producer of Public Health on Call. Today, air pollution and what we know about the cumulative effects of industrial emissions on people who live near petrochemical plants. Stephanie Desmond talks to Johns Hopkins scientists Dr. Keeve Nachman and Dr. Pete DeCarlo about their work measuring levels of pollutants in Louisiana and why government testing facilities are underestimating the risks to human health. Let's listen.
Keeve Nachman and Pete DeCarlo, thanks so much for joining me.
Thanks for having us.
So I wanted to talk today a little bit about the work you guys do together and sort of how did the two of you come together to do the kind of research you're doing, and tell us about that research.
This project started when folks at the Bloomberg Philanthropy started to ask us where we were missing information for communities who live around industrial facilities. And Tom Burke brought me into that conversation, and we had a really good few months where we were calling every couple of weeks and giving them thoughts and ideas on how to improve our understanding of what people were being exposed to and what that meant for health. And then they said, what would you do with some money for a pilot project? And we said we would do what we were just talking about. And so we were able to get some funding to start this project out together. And Key was the ideal person to take some of the measurement work that I do and put numbers to it in terms of health and understanding what health means. And so that started this project, and we've been going strong and really enjoying the work that we're doing.
So what is this project, Keeve?
We are trying to understand what it means to live in the shadows of large industrial or petrochemical facilities. And to do that, we need to measure what's in the air, what pollution is in the air, and try and take information about that pollution and translate it into some sort of estimate of how likely a person is or a population is to get sick from breathing it. And so we have taken this combination of Pete's and my forces. So Pete is an expert in measuring all sorts of different chemicals in the air, and my expertise in taking those measurements and saying, okay, if a person lives in a place and breathes all these different chemicals over a lifetime, what does it mean for the different parts of their body, for the different functions that the body serves, and how likely are they to get sick? One of the really amazing things that Pete and his team are capable of doing is they have developed and built this mobile laboratory on wheels. So it's like this fancy chemistry lab, if you can imagine, that's in the back of a very large van. And they're able to drive it and collect air measurement in real time. So actually measure levels of pollution in the air with the van over space and over time. It's really amazing. And they're able to, based on that data, deliver to me estimates of what people are breathing.
Mm-hmm. So, Pete, you took this mobile van to what's called Cancer Alley in Louisiana between Baton Rouge and New Orleans. I guess we should ask first why it is called Cancer Alley.
Yeah, so I want to echo something Keeve said too. This is very, very much a team effort. And while Keeve and I are here talking to you, we rely heavily on the team of people behind us who are making all this happen. Operating the mobile van in Cancer Alley is 4 people at a time kind of effort, way more than either of us could do. And the skilled people on the team make all of this possible. So Cancer Alley is a 85-mile stretch of the Mississippi River between Baton Rouge and New Orleans. And it processes about 25% of the U.S. petrochemical industry's products. And that stretch, because of that concentration of industry, there's a lot of byproducts that get emitted into the air, in the water, and in the soil. We're focused on the air in this project and knowing what chemicals are coming out when either they're refining oil or if they're making chemicals for the chemical industry, which also happens in that area. And so things leak out, things are emitted. Those chemicals at low concentrations can cause a host of effects, most notably cancer, which is why it's called Cancer Alley. So that's the main driver for where we went down there. It's just such a large concentration with so many different potential emissions. without a lot of data. And we wanted to kind of shine a light on what was there.
I just wanted to build on what Pete said, too. We, in no way, were the first to recognize that the area was at increased risk or it's been recognized as Cancer Alley for a very, very long time. And even with the data that EPA has about air pollutant exposures there, which we'll talk about in a little bit, this area of the country has some of the highest cancer and other disease risks in the nation. So this was a really, really important place, given the sources that were there, for us to go measure and try and understand what population exposures look like. Without a doubt, the people living in the communities surrounding these facilities are at the greatest risk of people anywhere in the U.S.
And so, Pete, the EPA didn't even have these numbers. Is that right?
That's correct. And so air quality measurement is done often at the state level with funding from the EPA to do that. And so states decide where they want to put monitors, and those typically are in populated areas. And so if you're looking at a map of where monitors are located in Louisiana, you'll find that the majority of monitors are located in places like New Orleans or Baton Rouge, which are the far either end of what we've been calling Cancer Alley in this conversation. But there's really not much in the middle, especially for kind of criteria pollutants. There are a couple measurement stations which do some subset of what we're calling hazardous air pollutants. And these are gases that we would find associated more with industrial emissions than you'd find in an urban area. But it's an 85-mile stretch. There's one or two monitors, and there's a lot more. There's 200 or so facilities in this space. So it's not nearly enough monitoring to really understand what people are breathing. And to put a finer point on it, what we found from our work is that many of the most critical air pollutants that are causing the highest cancer risk or the most impact to health other than non-cancer health are not being measured by those facilities. And so there's this really loss of understanding of what people are being exposed to that's going to be really important for knowing what health impacts we should expect to see in the people who live in these areas around these facilities.
What did you find?
One of the key pollutants that we really wanted to focus on, because I think in 2016, the designation for its cancer risk increased due to new evidence and new studies looking at it. It was ethylene oxide. And there are, I think, 5 or 6 facilities in the area of Cancer Alley where we're making measurements where ethylene oxide was produced. So it wasn't being used there. It's used in medical sterilization and some herbs and nut sterilization for foodstuffs, but it's produced in facilities in Cancer Alley. And so I think it's telling that whenever you're nearby these facilities that are producing it, we see the highest concentrations, which really isn't a surprise. But that means the cancer risk is not uniform throughout Cancer Alley for that particular chemical. Another really important chemical that we measured was called chloroprene. And this is chemical that's used to make neoprene rubber, which is, what makes up wetsuits and seals. And it's that kind of spongy rubber that we have in a lot of products. It's the only facility in the US that makes neoprene, but that chemical is also very carcinogenic, and it's located in one place in Cancer Alley. And it was the only place in all of our study that we saw that chemical. Nearby that facility is an elementary school. And so these are the kinds of things that you can start to see when you're doing mobile measurements and you're driving around making measurements while you drive and mapping out where you're finding these chemicals. And so we can understand the risk and how it changes across the Mississippi River corridor.
One thing that's worth adding, too, is that for a lot of the chemicals that we measured, either there are no government measurements or very sparse government measurements. And a lot of the data that are used to make judgments about the safety of controls to limit the releases of those chemicals are based on the industrial facilities' self-reports to state government about how much of these chemicals are coming out of their facilities. And one of the more notable findings of ours is that when we compared the real-world measurements that we made to these estimates from government models that rely on these self-reports, we found striking differences in levels of air pollution for some of these very, very potent carcinogens, which means that if we rely on the government's approach to decision-making around these chemicals and we believe their risk estimates, we are underestimating what people are truly experiencing and undervaluing the potential for them to get cancer and other diseases from breathing these exposures over their lifetimes.
And you found these different chemicals, and I assume that they mix together in the air, right? So what kind of cumulative effect could this be having on people?
That's a great question, Stephanie. So Pete mentioned some of our predominant carcinogens in the mix, but what I think he undersold was the fact that his team and his approach was able to measure many, many chemicals in the air. And we don't breathe chemicals one at a time, even though the way we regulate chemicals often makes the assumption that we do breathe one chemical at a time. And so one of the other exciting things that my team brought to the equation was a more sophisticated way to recognize that, hey, we're breathing tens or hundreds of chemicals all at the same time, and we need to be cognizant of the fact that those chemicals can work together to elicit harms to the body. So we developed a new approach that we just recently published that thinks about each chemical and all the different parts of the body that it may target. So let me make this a little bit clearer. When we regulate a chemical, the way we've always done it is we try and figure out what part of the body is most sensitive to that chemical, and how do we keep the exposures below a level that would trigger that most sensitive endpoint. And if we were only breathing a chemical at a time, that would make sense, right? Because you keep it below that level, you don't have any of the effects. However, when you're breathing tens or hundreds of chemicals all at the same time, and many of them target the same parts of the body, even if a single chemical doesn't rise to the level that you'd see an effect, the combined burden of all of those chemicals may threaten the different parts of our bodies. And so what we've been able to do is take the data that Pete generates by driving his mobile laboratory around Cancer Alley and try and put numbers to the combined effect of chemicals on the different parts of the body for people who live in that area. And what we see compared to traditional methods is that if you do risk assessment the old way, where we assume each chemical acts individually, we may not see a risk for a lot of different diseases and organ systems around the body. But when we consider the combined action of 40, 50 chemicals, we do start to see significant risks for certain health endpoints that tend to reflect the community experience.
Mm-hmm. So these chemicals together, are they the reason that this is called Cancer Alley?
I think the risk numbers that we're finding based on the measurements that we do and the number crunching that Keeve's doing suggests that it's very likely that these chemicals are responsible for some, if not all, of the elevated cancer risk. And I think to kind of highlight that, the estimated risk from the government models that are wrong is about 10 times too low in some of these parishes compared to what we're finding based on our measurements and risk calculations. That being said, the government estimates still have this area as one of the highest cancer risk places in the US. And so if they're underestimating that by a factor of 10, that's just egregious if they're trying to build more facilities in this space.
So these stunning findings speak for themselves. Where do we go from here? What are you all trying to accomplish? What can be done? Pete?
I think one of the important things that we're doing is this work, while the science and the technical stuff is things that we're doing here at Hopkins, we are working and talking with community groups in Louisiana and giving them the information, the tools that they need to advocate, which they've been doing for years. But now they have this data that they can bring forward and say, look, it's not just our feelings about the fact that half of our block has cancer. It's now we have empirical data that's measured by research institutions using the best available instrumentation and calculating the risk associated with these exposures that are backing up our lived experience. And we really want to stop any further build out of petrochemical facilities in our neighborhoods. And so I think where we come in is being able to provide that science-backed information for these community groups who have been on the ground advocating for decades to bring that to the table for their discussions with state government.
And Keeve, I'll leave you with the last word.
I think what we've done in Cancer Alley is certainly important for the residents of the communities surrounding facilities, but has implications far beyond Cancer Alley. It's certainly relevant in other industrial areas, but even beyond that, especially thinking about our new approach to understanding the risks of chemical mixtures on people. We are not doing regulatory risk assessments in a way that adequately protect people from multiple chemicals. And our recent publication is one of many that paves the way for a new approach to thinking about cumulative burdens from chemicals and even stressors beyond chemicals. And if we were to implement those approaches, we'd make better decisions about permitting, about intervening on people's risks to protect public health in a way that we aren't now. So that's really, really important.
Keeve Nachman, Pete DeCarlo, this has been a fascinating conversation. Thank you both so much for being here.
Thanks, Stephanie.
Thanks for having us.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.